The public health system in Romania faces major challenges, despite considerable progress in recent years. The infant mortality rate remains amongst the highest in the European Union, and life expectancy is low in relation to the EU average. In rural areas and for elderly patients with chronic diseases, access to high-quality medical and social services is limited. Responsibility for these services is mainly with the communities that are often ill-equipped to manage them. Switzerland has supported Romania in health sector reform for over 20 years, with the aim to reduce social disparities through integrated care solutions, emergency medicine, and intensive care. The Swiss Agency for Development and Cooperation and the Swiss Tropical and Public Health Institute have supported the implementation of the following health-related projects that brought Swiss expertise to Romania while simultaneously mobilizing Romanian expertise. Community Integrated Care. SimLab, a national training system for simulation in anesthesia and intensive care. Improved quality of emergency services. Improved pediatric intensive care. Community care centers were developed to provide basic health services at a community level to vulnerable populations. In total, over 100 home care workers and community nurses were trained. Over 300 elderly people received support, and over 200 children had greater access to services such as after-school programs and counseling.
The successful Swiss-Romanian partnership has improved people's life and created a stable environment. We think that the improvements in service delivery at local level has probably as well encouraged people to stay in remote and rural areas and not to migrate to cities or even Western Europe.
Simulation training is an internationally recognized method to enhance continuous professional development for health professionals. Swiss TPH has supported simulation training in Romania since 2000. The project introduced patient simulators for education and training in anesthesiology and intensive care, as well as in emergency services, which allowed physicians and nurses to enact realistic emergency scenarios.
For Romanian population, the Swiss cooperation program is better quality of healthcare in emergency, in intensive care or community care, for children and adults, for vulnerable groups such as elderly or chronic patients.
In addition to the community integrated care and SimLab, the improved quality of emergency and pediatric intensive care services also contributed to high-quality healthcare reform within the Romanian population.
Collaboration between Romania and Switzerland in the health sector lasts already for more than 20 years. Partnerships between Romania and Swiss hospitals, as well as professional associations, has helped Romania to access international networks and to connect to European professional platforms.
Significant progress in healthcare provision has been achieved in Romania thanks to the successful long-term Swiss-Romanian collaboration. Yet much work is still needed to ensure that all individuals have access to quality health and social services.